Do that. Okay, thanks for joining us, Doug. And thanks for everybody who's here in person. You got that lunch ticket. It says for Turner Hall only. That is not true. They'll take, I know they take them at Chick-fil-A. So just so you know, probably then at the new place that took the place of Einstein. So just heads up on that. All right. For some reason, we're stuck on a picture with Jose in it. So I'm sorry, Jose. You are our picture of the day. But you look great. Thanks for joining us. Okay, here in a few minutes, we're going to have our guest speakers join us. But until we get there, I've got a couple of things. Just kind of heads up. This is our first meeting of spring 26. So thanks for coming. We've got 2 more this spring. The next one is 311. So that made it handy, right? 211, 311. We couldn't keep the theme going though. So in April, we've got it on the 8th. So this time we're talking to some surgery suite pharmacists, learning about what that kind of work is like. And then the next time we meet, we're going to actually have one of our professors here, Sister Michaela. Now she's had practices in a lot of different areas in cardiology and family practice, and now she's a professor. So she's going to talk to us a lot about all of those options. We're going to hit a lot of options in one session next month. And then our last one for spring is going to be in April. And that's when we're going to have our PharmD student panel. So we'll have a selection of students that are currently PharmD students. The ones I have my eye on right now, I think are P2s this year. So they're in their 2nd year of pharmacy. So they've got some experience, but they haven't moved on yet. So they're going to come and, you know, tell you what they think you should do or not do, how to prep, all that. So that's kind of what our lineup looks like for spring. So summer registration for ISU is happening now. So if you're thinking about summer classes and you need some advice or help with that, let me know. If you're on another campus there at UAA, keep your eye out for when that happens. Talk to your advisor up there. I know Carrie Brown up there is a really good resource for you. Mara is also a good resource for you. And then fall registration will be around the corner. So the end of March is typically when we start fall registration. Confirm, Keenan? Is that kind of your thinking too? Yes. He gets wrapped up into a lot of our NSO stuff, so he kind of has the inside scoop sometimes. So keep your eye on that. If you need some help selecting courses, finding out that you need to have a different plan, just let me know, let Rhonda know. We can help you with that. Last day of W, so that is around the corner. I like to give people heads up on that. So the last day to drop a class, check your campus for that date because it'll come up pretty rapidly. For us here at ISU, that's going to be March 9th. So since February is a short month, that sometimes shows up faster than you think it will. So keep your eye out for that. If you think that class is going to be a D or an F, maybe it's time on 3/8 to go ahead and let go of it. Okay. Sometimes, you know, it's good to hang on until you get to March 8th and see if it's going to pull out. But just let me know if you need some help then refiguring things. There's still time to sign up for late 8-week classes. So again, if you're not on the ISU campus, check with your advisor. Or just go to your website and go to your academic calendar. That should tell you about late 8-week classes. Most universities offer a late 8-week, which means if I drop a class right now and then I go under 12 credits, I can still grab another class and add it to my schedule to get myself back up to 12 credits. And so those classes, I believe they start on 3/9. Oh, I'm sorry, 3/20 is the last day to drop with a W. So I've got 2 dates running here. 3/20, so that's more the end of March. Got a little more time there. And then late 8-week classes start 3/9. So keep in mind, if you want to add a late 8-week class, you got to do that before the 9th of March. Once those classes start, there's a very short window to get into them. So you can do that anytime now until there. Okay. Again, check your campus. calendar to make sure if you're not on the ISU campus. It's not too late for fall 26ers for the Farm D. So how many of you are interested in fall 26, have already been admitted or working on it? Okay, so a bunch of us. Great.
Yeah, and I'm in the interview on Friday.
And
This is
who was
Cody.
that? Oh,
Cody.
Cody. Yes. Yes, I know. I've been watching for you, so I'm glad you got in on one on Friday, and we'll be watching for how that's going to go. And I'm sure it's going to go great. How many people are in that interview, Rhonda? One. So you'll only have 3 other people besides you, Cody, so it should go fast.
Okay.
Okay.
I was gonna go with whatever.
Yeah, you're going to do fine. No, just roll with it. Okay. So if you have any friends that are like, oh yeah, I'm thinking of fall 26 and they don't come to our meetings, you might push them a little bit because we are getting to spring and now we're getting close to our deadline, which is April 1st. That's not the best time. All right. And again, I'll be at UAA this Friday, 2/13, and then Saturday for that pre-med event. So if any of my University of Alaska students want to catch up with me out there, let me know. And Eddie, I already heard from you. Cody, are you going to be able to make it over?
Yeah, I was planning on it. I'm up here in Anchorage all weekend this weekend, so
Yeah,
that
great.
was my
Well, yeah,
plan.
yep, that'll be great. You can just come on over to either the pre-med event or you can catch up with me on Friday too. That'll be fine. Okay. Well, we have our guest speakers in the room yet. Okay, what time are we got? What's that? Yeah. Yeah, I think so. Yep. Stacy, are you with us?
Hi, this is Hillary. Can you hear me?
Oh, Hillary, yes, I can hear you. And we can see you
Okay.
too. Awesome.
Yeah, we had some connection problems. Sorry about that.
Oh, that's fine. So thank you for joining us. These are the students you're talking with. I think you've joined us in the past, are
Yes.
pre-pharmacy students
Okay.
that are here at ISU. Some are in Alaska, some are from a variety of places. And we're all just interested to hear about your line of work, how you came to be in that line of work, and maybe some pros and cons or a day in the life of.
Okay. Well, I actually am originally from the East Coast. I went to pharmacy school at Shenandoah University in Virginia. I graduated in 2011. And I started out my career in a small community hospital in a rural setting. Um, Primarily worked on a med-surg type floor, but also rotated through the central pharmacy. At that hospital, we were all required to work kind of in a clinical setting on the different floors of the hospital, but also work in the main central pharmacy so that we could keep those skills. So we all kind of had to rotate and take turns throughout the different departments. So I worked there for several years, and then I worked also in the outpatient setting at a community clinic. Um, and then about 4 years ago, I had the opportunity to come out here to Boise to work at St. Al's, which was a much larger hospital than what I was used to, a trauma hospital. But actually, the job is pretty similar to what I was doing at the smaller hospital. I'm just in charge of or responsible for more patients. But I primarily work on the medical surgical unit, taking care of the medical oncology patients and also the post-surgical patients. And similar to my last hospital here at St. Al's, we also rotate through main pharmacy. So we kind of keep those skills active as well. Oh, and sorry, Stacy is now here as well. Um, yeah, are there any questions, I guess, specifically about the job or what we do, what we're responsible for?
My video back. There it is. Can you tell us what makes like surgery suite work different then maybe working in the main pharmacy of the hospital? What do you do there?
Okay, so up on the surgery unit, we're primarily taking care of the patients that are post-op. Mainly the ortho joint, I would say, makes up the majority of the patients, and a lot of the general surgery patients are kind of a variety, but I would say we see a lot of abdominal surgeries.
Yeah, that's a big chunk of it.
Post-bariatric surgery. So part of that entails we manage the TPNs. So we work in conjunction with the dietitians, and they're kind of determining the nutritional needs for the patient, and then we're determining the electrolyte replacement. And so we kind of work with them to develop a recipe, and then we manage that. We follow that from day to day and make adjustments. We make sure that the patients are on appropriate anticoagulation after their surgery to prevent blood clots. We're also involved in antibiotic kind of management, I guess, for certain maybe post-op infections or prevention of surgical infections. I'm seeing anything.
Another difference I'd say there is between like our floors and some of the critical care areas is that sometimes it feels like it's a little bit faster paced because we cover a big chunk of patients because they're typically not as sick. Our workload, we're usually covering about 70 to 75 patients every day, and we're responsible for the clinical consults. So it's the admission to discharge definitely happens a little bit faster. And I feel like there can be days that are extremely busy where we're trying to prioritize our workload and decide what needs to be done first and just getting constant interruptions. But the busy workload up there is something that I enjoy, and also that the patients being non-critical care is something I enjoy as well. Just because if something comes up where there's like a medication question that is coming through to us and it's not making any sense, we're able to go in and talk to the patients and just ask them, hey, what's going on? Are you on this medication? How are you taking it? And get our answers versus like the critical care pharmacists. They're not always able to go in and speak to the patient and ask them.
Yeah, and I would say contrast that with working in the main pharmacy. Primarily, we're responsible for basically expediting things out of the pharmacy, so order verification. We're checking all of the IVs that are being made in the clean room. They're coming out, and we're batching a lot of things. The technicians are pulling a lot of drugs, making oral reconstituted solutions, and then just pulling your general like tablets in pill form, things like that out of, we have a robotic carousel. And so all of those things, of course, have to be checked by the pharmacist. So they all get passed on to us. And so we're really trying to move things from the pharmacy to the different areas of the hospital. There are clinical consults that do come through. So during the day, whenever the day shift pharmacists are here and scattered throughout the different areas, like the surgical unit or the ICU or the medical oncology unit, those pharmacists primarily cover those consults. But then in the evening, when those pharmacists are gone, that does fall to the pharmacists that are working in the main pharmacy. So we don't have as many people here in the evenings and at night. So then that clinical work does get passed on to whoever's staffing at that point in the main pharmacy.
What are working hours like for you?
We have a variety, I guess, of shifts. I would say when we're on the floor, that shift is from 6:30 to 5. We work 10-hour shifts. And I would say the majority of the floor pharmacists are coming in around that time, or maybe coming in at 7 and leaving at 5:30. Then in the main pharmacy, our first pharmacist that kind of comes in, we have two, one that primarily manages the IV medications, and then the other one we call our D1, our kind of daylight pharmacist. They both come in at 6 and then they leave at 4:30. We have a D3, which is I guess almost like a float shift. It's sort of in the middle, and that's from 10 to 8:30. And then our evening shift is from 1 to 11:30. And then night shift is 8:30 to 7 a.m.
A lot of different shifts. I think for any of the pharmacists who work up on the satellites or they have an area where they usually it's about like 2/3 of the time up on that satellite, and then about a third of the time staffing in the main pharmacy. So it's kind of nice staffing in the main pharmacy because we get to see everything. Like Hillary was saying, when the clinical pharmacists up on the floors go home, the pharmacists down in the main pharmacy are responsible for everything. But that would be probably my biggest complaint about my job and anybody working in the hospital pharmacy is that our shifts aren't the same week to week, and we are responsible for helping out with the overnight shifts. If say one of those pharmacists who usually staffs those shifts is on vacation or sick, we rotate, all of us rotate through those shifts, whether we've been here for a few months or we've been here for 30 years. Everybody equally is responsible for getting those shifts covered.
Okay, so you work 10-hour days. So I would assume you do 4 days on and then how many days off? Or is that the case?
Easy. Our week to week is different. Like I just worked 6 days in a row with my shift yesterday being from 6:30 to 5, and then today I'm working from 1 to 11:30, and then I'll have a couple days off, and then my next week is going to look completely different. So it's different. It varies from week to week. If we had 4 on, 3 off, I would love that. I wish we did, but it doesn't work out that way. Yeah.
It sounds like a person who likes variety would be well suited to that kind of work. Who would be bored if they were in one spot and couldn't do anything else.
Yeah. One of the things that I do like about working here, if you like, we are in the surgery area and I've been there for almost 15 years, so obviously I like it. But there's always things that are opening up here, like different parts of the hospital that we'd have the opportunity to work if we wanted to. A couple of years ago, they opened up the neuro ICU and then like a neuro step down unit. And that opens up pharmacist positions for people to apply if they're interested. And then there's always like pharmacist shifting that happens. So it's nice to be able to, if you wanted to learn something else, you always have the opportunity when things open up to interview for a position in that area and be working there more frequently.
Yeah, and we've actually gone to management and advocated for new positions and been able to create those new positions and get FTE approval from the department managers to, have those open positions. So like we have an infusion pharmacist. That job was created within the last probably year or two. So that pharmacist is responsible for all the patients that are coming in and getting an IV infusion. They don't need to be admitted to the hospital. They just need to come in and get that IV medication and then they can go home. But that required a lot of manpower. And it was kind of stressful for the pharmacists working in central pharmacy to manage that. And so we were able to get approval for that to be one person's designated job. And then the other really nice thing that we were able to get, I guess about 4 years ago, was an OR pharmacist. So that position was created too, to have one person designated up in the OR to handle all of the orders that are constantly coming through and to also get medications ready the day before surgeries, so that, early in the morning, whenever the patients are here and the providers are getting ready, they have everything they need. They're not having to call pharmacy and we're not having to scramble to send things through the tube or to deliver things to them. They already have it up there. And then she's up there able to answer their questions, which is great. So it's been really nice being able to create the positions that we need for the department based on the work that we're seeing.
Any of you have questions in the room or in the Zoom? Feel like I'm asking all the questions. I'm stealing your thunder. Oh yes, go ahead.
Yeah, I'm just curious about the typical workflow from at the time they clock in and it's the workflow.
So the question is, what is your typical workflow from like when you clock in to when you clock out? Probably depends on what floor you're on or that sort of thing, but what would be typical, say, if you were on the surgery suite?
Yeah, on the surgery floor, when I come in, I'll look and see. We work with Epic, so it's nice that if we have results coming back for any of the clinical consults that we have, like our warfarins or vancos or our heparins that we're monitoring, it drops that into like an in basket for us. So when I get in, I look and see if there's anything that needs to be dealt with right away. And then I can look through we have IVents, which is how we kind of communicate on a day-to-day basis on what our clinical consults are for the floor, and I'll go through those. We also have interdisciplinary rounds, they're more like discharge focused, where everybody gets together who's involved in the care for a patient, like the case resource managers, which make sure the patients have what they need, the providers, the hospitalists are there, physical therapy, just everybody involved in the discharge plan. And pharmacy is also involved in those. Those typically last maybe 30, 45 minutes on the surgery floor. And then when we get back up to our space, we can have time to sit down and go through those consults and see what labs need to be ordered, get our notes entered for the day, and help with order verification for the rest of the hospital.
Okay. So if one of our students were interested in coming to work there where you are, how would they get there? What would they need to do?
I know my recommendation would be to get involved in hospital pharmacy, inpatient hospital pharmacy, and see if it's something that you enjoy. I started out, I don't know, 20 years ago working at St. Luke's Meridian Inpatient Pharmacy, and I met a lot of great pharmacists who were extremely helpful and good mentors and helped me get to where I am today by writing recommendations. Um, Another piece of advice that I have, we'll see if you guys do pharmacy school, a lot of you guys, because we do take on a lot of learners here at St. L's, both as when you're in pharmacy school doing your IPPE and on your fourth year doing APP, kind of treat it as a job interview. You're going to meet people and get to network, and also if you get the opportunity to present or do a journal club in front of the pharmacist, it's a good opportunity to get your name out there and meet everybody, I guess, and show that you're willing to work. Because it's when you show up later, if you're wanting to do like a residency, it's helpful if we know who you are and know what your work ethic is like. So those are my two. Sorry.
Yeah. No, you're good. So search for those experiential learning opportunities that put you in a hospital that,
Yeah.
and then be sure that when you're in that learning experience, like you're on time, you're doing all the things that they ask you to, like you're a go-getter, you're a learner, you reach out, ask for help if you're not sure about something, like you're doing all those professional things that, we keep reminding our students they need to do there so that you shine forth, so that those pharmacists there remember you and they know you're a good worker. Is that right?
Yeah. Yeah, for sure.
Excellent. Okay. Other questions that you have?
I guess I kind of have a question. They kind of answered already. I know the hours are pretty long, but how do they feel their work-life balances with like the varied shifts and
Yeah.
the long hours?
Yeah. So the question is about work-life balance. How do you manage your work-life balance with the varied shifts and things like that? It's a hard question. Yeah.
I feel like the paid time off that they give us is fairly generous, and the longer we've been here, the more paid time off we get. I don't know what it comes to a year, but I about this time I'm always like at my max paid time off, so I need to take time off. So I when we're able to take time off, like you're forced to, I guess, in a way. So it does help with the work life balance. But like I do like the 10-hour shifts and that we do have 3 days off a week, which is nice. We tried the 8-hour shifts for a while and it made things a lot harder. But like having the 3 days a week, even without getting those extra days off, it feels like I'm able to get everything done that I need to do. And the people that I work with, I feel like we do have a great team. And that if I was needing an extra day off or I was wanting something off for one of my kids' activities, I'm able to just ask somebody and switch the shift. And we have PRN pharmacists as well, who sometimes they are able to pick up shifts if we have something going on.
And I would say, we have a pretty supportive department as far as our coworkers and our management. And there are days when we might have to stay a little bit late because we're that busy, but then there are other days where we have everything done and we can leave a little early, we're encouraged to do so. So, as long as you're communicating with your other pharmacists and giving any handoff that you have, then it's okay if you want to leave a little early that day. Maybe you have something to do, or maybe you don't necessarily have something planned like an appointment, but you really just want to go out and, leave maybe an hour early or something like that. Enjoy the day. That's okay. That's actually kind of encouraged. So,
Yeah, I think too, with having 3 days off, not always the same time or the same days every week, can have an
It's-
advantage where you have time off on a weekday where you can go to the bank, that sort of thing. Very good. Any other questions? Anybody online have a question? Anybody in the chat yet? Okay. Well, no other questions? They're all just thinking it through. It's a lot to know. So we have a number of students in the group right now that are starting in fall 26 in the PharmD program. And some of them will be in Meridian. So we have a number there and a bunch here in Pocatello as well, and some in Alaska as well. So we'll be sending students your way.
Yeah, I look forward to meeting you guys. The students are a fun part of my job. It's fun having them here.
Oh, great.
I'll get to listen to you guys if you come here present.
Well,
One question.
there is one question. Go ahead, Rhonda.
Are there specific designations to work in some of the, I don't know if you're.
Let me look at the chat too. Are there specific designations to work in some of the unit, for example, for oncology? Did you hear that?
By designations, are you meaning like requirement? I'm not sure. I guess I understand the question.
I'll just ask it out loud. Yeah. So if
Okay,
you're
good.
working in the hospital on the different units, depending on where it is, for example, like oncology, do you need certain designations to work in those units? Or is it just once you're a pharmacist, you're able to work in all of the different areas?
Do you mean like
Yeah, I think-
designations like training?
Yes.
Yeah, some of our staff have residencies, some don't. Some have experience already in certain areas. And then there are pharmacists that maybe don't have an experience in that particular area, but want to work there eventually. And so we do provide that opportunity if someone's really interested, say, in working in oncology or working in the NICU, we can provide that training. So I don't think that we necessarily would tell someone know that it's not possible or it's not going to happen. But I think just based on what they're already coming in with, are they they've completed a residency or they've already worked maybe somewhere else, but in a similar type of unit. So maybe they're ready to go and start in that unit faster versus someone else who might need a little bit more training. So it kind of depends on the situation, but I think that we've had a lot of different pharmacists show interest in different areas, and we've provided the training to get them that exposure to that area so that they can go and work there. So I think if you were to come here and you say, I really like this particular unit and I want to work there, then we kind of do what we can to get you to that point.
Yeah, I agree. I've seen people move into our oncology department who have done residency and those who haven't, and those who don't have a whole lot of experience in the oncology world. So they do get the training and they get the opportunity to to learn what they need to know in that area.
Good, thank you.
Thank you.
Any other questions before we let our
I
pharmacists?
I have
Oh,
one.
Eddie,
I'm
go
sorry.
ahead. Yep, go ahead.
I guess what has been some of your guys' biggest challenges as being pharmacists in your guys' current position?
For me, it's definitely the schedule. I don't enjoy working holidays and everybody rotates through the holidays or nights. I wish I didn't have to, but I really do enjoy like the workload and what I'm doing with the clinical consults and having the students with me. But the schedule is challenging.
Okay.
Yeah, I would agree. I wish we could get to a point where we had a little bit more of a regular schedule. Um, I'm one of those people that actually prefers the 8-hour days, but I understand that's never going to happen here. So I've made peace with that. But um, yeah, I think even though that's, the 10-hour shift is maybe not my preference, and maybe having a rotating schedule from week to week and having to do the nights and the holidays, even with all of that frustration, we have a really supportive department. I really like the team that I'm part of, the med-surg team. I like the management that we have. And so having that kind of helps me. It makes the other things easier to deal with, I would say, and, less painful. If you have a supportive team, then you can sort of deal with all of the other parts of the job.
Okay, cool.
Yeah.
Thank you.
I can totally see that. We kind of operate that way here too. All right. Thanks, Eddie, for that question. Any other questions that you have? Okay. Oh, yeah, go ahead. Sorry, I've got hearing issues. Stay relax. So the question is, how much patient interaction do you have in any given shift that you're on?
I would say direct patient interactions probably pretty minimal. Mostly we're confined to our office and meeting with the other members of the care team, like the providers, the nurses, nurse managers, case managers. But we do have the opportunity. Sometimes a question will come up, or there might be an instance where we decide to just go into the patient's room and speak to them directly, or sometimes call a family member. Usually, it'll be a question about one of their home medications. Are they still taking it? What's the correct dose? So in those situations, sometimes it's just easier to go in and just speak to the patient. But I mean, there's probably days where I don't speak to patients at all, and then every once in a while I might have, a brief interaction, but it's not a lot.
Yeah, I feel like it's up to like how much you are wanting. One of the things I do like about our job is we have our satellite up on the floor. But you're not like confined there. You're able to, there's work that we have to get done, but you're able to get up and then go ask the patients questions about their home medications, or sometimes the nurses will have us ask us to do some sort of education for some medication that the patient's taking. So it's kind of up to you as well on how much interaction you are wanting with the patient. I will say that our pharmacy interns that we hire that are in pharmacy school, we like to have them staff in the ED, and they're responsible for doing the med recs with the patients. So as the patients are coming into the emergency room, they're trying to meet with as many patients as they can and make sure that we have a correct, up-to-date list of all their medications. And so that is a huge help to us because our interns really do a great job and try to talk to a lot of patients to get that information as accurate as they can. And I think that's good practice for them because it's, they're learning the medications by constantly having to talk about them and review the dosing and things like that. And they're also getting a lot of patient interaction if that's what they want. Maybe some do, maybe some don't want that much patient interaction, but I think it's good experience and we appreciate it because once, the patients are admitted, if their medication list is correct, then
it's a lot less, it causes a lot less problems because then we know that we can continue the correct medications and we don't have to go back later and try to undo, giving them the wrong medications because we didn't have the right information to start with.
So I think the neat thing about your work is that, like you said, you can be involved with patients or not, or less so, and for some people who have experience in community pharmacy, which a lot of our students do, they get a little bit worn out with patient interaction, because it's so intense in those settings and people are always a little frustrated about medication or their insurance or whatever. So I think this is a great option for a student who's like, yeah, I tried community pharmacy and that's not really where I loved being, but maybe hospital pharmacy is a better mix for them. Okay, great. Any other questions?
I guess I'll ask,
Yeah,
what
go
advice would you have for someone who is starting pharmacy school to be successful?
I would say just study, listen to your professors. When you do get the option to go see different places, take it seriously and see what you enjoy.
Yeah, I think my biggest, I guess, thing that I kind of maybe struggled with P1 year, but then eventually kind of came to really understand because it was a big switch from, undergrad to pharmacy school, is for me, I just really needed to make sure that I didn't get behind on anything. Keeping up with the work and the studying for me was kind of like I had to really be organized and kind of make sure that I knew exactly when everything was due and when my tests were and plan, my study time appropriately because it felt like if you got behind even one day, it just became really overwhelming to try to make up that time and to try to get caught up. So I think for me, I had to personally make sure that I was always, on top of that. And then also, like Stacy said, ask your professors what their work experience is. I mean, I had professors from all walks of life in pharmacy school. Some had worked in the outpatient setting, some worked, in like inpatient psych facilities. They all kind of brought something different and they liked to talk about where they had worked. Some of them still had that active, maybe they were at the pharmacy school 2 or 3 days a week, and then they were at their clinic the other days of the week to kind of maintain their skills. So that kind of opened up for me different possibilities that pharmacy is not just working in a retail setting. You can work in a clinic, you can work in a hospital, you can work in a long-term care setting, you can work in a home infusion setting. So there's a lot of different job opportunities, and I would say just try to, explore as many of them as you can. If you've tried one and you don't like it, it doesn't necessarily mean that pharmacy isn't for you. It may just mean that, you might need to pursue a different pathway.
I agree.
Great, thank you for that. All right, well, we're nearing the end of our time. Any last minute questions before we let our pharmacists go? Yeah, go ahead. Yeah. Right. So how do you keep up with your continuing education? And are there any specific kinds of continuing education that you have to do?
I think with Idaho, it's now just general. I did the board certification, so I enjoy doing that CE that they have for us, the continuing education they have for us. I think it's helpful. I can pick and choose what I'm interested in, and that pertains to the areas where I work. They also do a lot of education here. This room, the students will give presentations on interesting patients. If there's like any significant guidelines that have been updated, they will give presentations. The residents will as well. We do a lot of like preceptor developments to make sure that we are like engaging with the students and giving like the appropriate feedback and just information for us to better precept. So they do a lot here as well.
Yeah, and I have some licenses from other states, and so each state has its own CE requirements. They're not all the same. Some you have to have specific, maybe immunization CE or HIV, or some require live CE. You can't just do it all kind of as online. You have to actually sign in and kind of watch an actual presentation. Yeah, it kind of depends. If you're just licensed in Idaho, I believe it's 15, just sort of general CE, and that can be up to you. Most of us here are licensed in Oregon also because we do telepharmacy for some hospitals that are in Oregon that don't have pharmacist coverage at night and on the weekend. So we have to maintain the Oregon requirements too. I think they have pain management.
Yeah, some might be different.
Yeah, so yeah, it depends on where all you're licensed that determines what CE you have to do.
I do like NABP has a website and it's not very expensive, but it helps you keep track of what each state needs so that you're making sure, because I wouldn't want to miss something just because I missed it, but it's not, it's maybe like $20 a year and it keeps track of everything for you.
And that was NAPB?
NABP.
BP. Okay, well, that's
National Association of Boards of Pharmacy.
Yeah, there we go.
we'll encourage our students to talk to you about that in the future, because that's a little ahead of them, but
Yeah,
thank
you don't have to
you.
worry
Yes.
on it now.
Yeah. Yeah, and I think, in most of these kind of areas, you do have to do continuing education because things are changing. Medications change, new medications come out, different ways of managing illness comes to the fore. So those are all really important things to keep on top of. All right, well, we're about out of time. Thank you so much, Stacy and Hillary, for joining us. We really appreciated your time today.
Thanks for having us. I
Thank you.
appreciate it.
Thank you. See you later.
Bye.
All right. All right, everybody, thanks for joining us today. So what do we have up here? Come in. So next time, 311. We are going to have a lot of different areas of pharmacy represented in our next session. Rhonda, did you have something?
Yeah, I just wanted to say something. So they brought up an interesting point about certifications and things like that. When you are in the pharmacy program, you will get a immunization certificate after you do your training, and that's like the first thing you do, I think, when you're in the program. And please hold on to that certificate because it is something that you will need probably throughout your life. And I can't tell you how many past graduates, especially after COVID, because of all of the immunizations that pharmacists started doing nationally, but they have to come back to us to get new certificates for that immunization training to prove that. So just make sure you hold on to those certificates like forever. Put that in your forever file once you get that. Thanks.
Yeah, that's a very good point. We get those calls all the time. We're like, from 2001. We're like, were you a student here? I don't know. It was before my time. All right. Well, I will sign off for this time and we will catch up with you next month. Thanks for coming.
Thank you.
Thank you, Linda. Appreciate it.
Thank you.
Bye.
Thank you.
Thank you.
And I will see you on Saturday.
All right. Sounds good. Thanks, Eddie.
Yep.
Into the Great White North.
Yeah. Right. Also, for those of you